Welcome back to Fox Recaps. Today, I'm going to explain Episode 1 and 2 of the series The Good Doctor, released in the year 2017. Dr. Shaun Murphy is an autistic surgical resident. He is looking to move from his quiet life in his hometown to San Jose, California, to join the prestigious St. Bonaventure Hospital's surgical unit. Although autistic, Shaun is an excellent surgeon with near photographic recall and the ability to note minute details and changes. In the beginning, he packs his luggage and says goodbye to his childhood home. On his way to the airport, he passes a football field and recalls the several times he was bullied but was saved by his younger brother Steve. On arriving at the San Jose National Airport, Shaun is overwhelmed by all the noise. All of a sudden, some workers accidentally drop a glass board on a teenage boy, injuring him seriously. His parents run to his side, along with a man who claims to be a doctor. They see that the kid has been stabbed by shredded glass on his neck. The doctor uses a clean cloth to stop the bleeding, while Shaun examines the situation from nearby. Everyone waits for the help to arrive in complete silence when Shaun comments that the doctor is killing the kid. He further explains that the boy is not an adult, which means the doctor is putting pressure on his trachea and suffocating him. He rearranges the doctor's hand and looks for other injuries. Meanwhile, in the St. Bonaventure Hospital, a board meeting is held to discuss the arrival of an autistic surgeon. The president of the hospital, Dr. Aaron Glassman, has hired Shaun and has known him since he was 14. He is the only one in favor of letting him stay as a surgical resident of the hospital. All of the other directors are skeptical because of Shaun's medical history. Dr. Marcus Andrews, who is the chief of surgery, is strictly against hiring him. President Glassman tries to persuade the others by listing all of Shaun's capabilities, but nothing he says satisfies them. In the meantime, Dr. Kalu and Claire are hooking up in one of the hospital rooms. They're disturbed when Claire is called to make a patient sign a consent form. As she is getting ready, Kalu mentions how no one knows about their relationship. To his disappointment, Claire claims that they are not dating just yet. Back at the airport, Shaun uses his photographic memory of the human circulatory system to find out that the kid's lungs are in distress. This means that he will have to perform a procedure to let the air free that has accumulated in the space around the lungs. He goes to the security checkpoint to ask for a knife, but they refuse to give it to him because of safety reasons. With no way out, Shaun snatches the knife and runs away only to be pinned down by security. The kid's mother explains to them that he is trying to save someone's life. Back in the hospital, Claire asks an older patient to sign the paper of consent for his heart surgery. The man is scared and wants to wait for a second opinion. Claire arranges for him to meet a psychologist to calm him down. However, her superior, Dr. Neal, asks her to get the signed papers immediately. When she tells him that the patient is panicking, the doctor asks Kalu to do it instead. It is clear that most of the doctors are practical, while Claire is more sympathetic towards her patients. Meanwhile, at the airport, Shaun returns with 2 bottles of alcohol, a tube, and a knife. He disinfects everything and cuts a little hole in the kid's chest. Using the tube and the bottle of alcohol, he creates a makeshift one-way valve and lets free of the accumulated air, making the kid breathe again. Everyone claps for Shaun, praising him for his quick thinking. The doctor beside him is amazed by his abilities. A flashback shows us that Shaun was physically abused by his father during his childhood. After he was kicked out of 3 schools because of his condition, his father killed his pet bunny. Shaun and his brother Steve took the bunny to the doctor's where he met President Glassman for the first time. Following that day, the brothers started to live on a bus far away from their parents. One day, while playing in a warehouse, Steve fell from a high platform and passed away. This is the main reason Shaun wants to be a surgeon. Back in the present, Shaun and the kid's parents are in the ambulance when he notices a slight fluctuation in his heart rate. However, the paramedics refuse to believe him. When they arrive at the hospital, Shaun tells Claire that the kid needs an echocardiogram. But since the report shows no fluctuation in his heart rate, she doesn't believe him. When he insists, the security kicks him out of the hospital. Dr. Neil Melendez and his team are treating the kid when he also notices the slight change in the heart rate. He and Claire quickly meet Shaun and ask him why he said the kid needed an echocardiogram. He is brought back to the hospital and shown the results. On examining them, he quickly finds out that a piece of glass has entered the kid's bloodstream. According to his suggestion, the doctors perform the surgery and find the piece of glass in the kid's heart. Back in the board meeting, President Glassman says that he will give up his position if Shaun fails to be a good doctor during the first 6 months of his employment. Yet, the board votes against his hiring. Before they can leave, the members are shown the viral video of Shaun saving the kid in the airport. He is then brought to the meeting and asked why he wants to be a doctor. After pausing for a minute, he claims that he couldn't save his bunny and his brother when he was little, so he wants to provide other people an opportunity in life. Following the brief interview, an impressed board hires him. President Glassman sends him to his first official surgery under Dr. Neil Melendez. The doctor keeps him in charge of the suction and tells him that he doesn't belong in a hospital. Shaun doesn't take his words to heart and in turn says that he has a lot to learn from him. He also asks Neil if his arrogance helps him to be a better surgeon. Everyone, including Claire, is stunned by his honesty. That night, Shaun sleeps on the floor of his new apartment. He has set alarms that help him navigate his morning routine. He excitedly goes to work but is 5 minutes late because of the bus. He is in Dr. Neil's team of surgical residents. The group consists of Neil, Claire, Kalu, and Shaun. Neil scolds Shaun for being late on his first day at work and sarcastically mentions the board made the right decision. Shaun, incapable of noting the sarcasm, thanks him. They are called to review the reports of a woman suspected of having a tumor in her abdominal area. On getting a look at the reports, Shaun instantly finds out that she has a malignant tumor called sarcoma. The woman panics, thinking that she is about to die. The doctors bring Shaun aside and teach him that although he should always be truthful while talking to patients, he shouldn't make them panic. According to Shaun's diagnosis, the team gets ready for the surgery to remove the tumor. However, Neil appoints Shaun to do the easier jobs around the hospital. Shaun doesn't complain and instead says he looks forward to doing the scut work. He then continues tending to the patients with minor problems. However, he proposes to do several tests even for minor problems to be absolutely sure of the possibilities. The nurse assigned with him starts to get frustrated but doesn't say anything to stop him. A while later, President Glassman asks him why he isn't in the surgical ward. After finding out that Neil has assigned him to do scut work, he believes that Neil is doing it because of prejudice. Meanwhile, Claire is with the patient who is waiting for her tumor surgery. She is scared because she has to attend her son's wedding in 2 months. To make her feel better, Claire tells the woman that there is a very high chance of her survival, which is clearly false. Kalu belittles her for breaking the medical law, but Claire argues sometimes being truthful is harmful to the patients. Dr. Marcus tells Neil about the unnecessary tests that Shaun is making his patients go through. He is keeping a close eye on Shaun to see if he messes up. Shaun, on the other hand, is treating a little girl who has come in because of a stomachache. Her parents do not stop bickering the entire time they are there. Shaun requests several tests to find out the cause of the pain, but before it can be processed, Neil stops him. He finds out about the parents' bickering and says that the cause of the ache is probably stress. He asks the nurse to be Shaun's mentor for the rest of the day and help him figure out what test is needed and what isn't. Shaun is not satisfied with the little girl's results, but he agrees to do what Neil says. A flashback shows us that Steve and Shaun asked for money from people to survive. Shaun doesn't like to lie, so Steve does the task most of the time. Back in the present, he continues checking the patients under the nurse's authority. Meanwhile, Neil, Claire, and Kalu start the tumor removal surgery on the patient from earlier. To their surprise, the tumor is a lot bigger than they had anticipated, and they have no view of the organs. Shaun is called to the operating room, but they only ask him to get the biopsy from the lab. He is a little disappointed that Neil doesn't want to include him in the surgery. At the lab, he asks the nurse to hurry up, but she simply orders him to wait. This reminds Shaun of the time his brother had thrown a rock at a person's window to teach him he should be courageous. He tells the nurse he will throw rocks at her if she doesn't do it quickly. The woman laughs and asks him to wait for a few minutes. He brings the results back and examines them. While the other doctors conclude that nothing can be done to save her, he suggests they remove one of her healthy kidneys to get a clear view of the tumor. Later, Claire and Kalu are discussing the surgery with Neil when Kalu presents Shaun's idea as his own. Neil compliments his quick thinking and decides to remove the woman's kidney. Claire is against the idea of removing a healthy organ because even that won't ensure her recovery. But since the majority agrees, they continue the operation. Against Neil's instruction, Shaun runs several tests on the little girl who had an upset stomach. He finds out that she has intestinal malrotation, which can be fatal. Not thinking much about it, he rushes to inform her parents. They think he is a lunatic and ask him to go away at first. However, on checking, they find their daughter lying unconscious on the bed. They quickly drive her to the hospital while Shaun gives her CPR in the back seat. Somewhere else, the tumor removal is successful and the woman is saved. When Shaun arrives with the girl and does an ultrasound, he finds out she also needs minor surgery. Since Neil is busy, he goes forward to do it on his own, but is stopped midway. Neil thanks him for the help and asks him to go home. Dr. Marcus, on the other hand, orders Neil to bring Shaun back to his team because he has proven he deserves to be there. Neil reluctantly asks him to be in charge of the suction. Later, Dr. Marcus and President Glassman bump into each other in the bathroom. Dr. Marcus bluntly admits that he is praying for Shaun's downfall so he would get to be the next president of the hospital. The only reason he vouched for him today was to give him authority so he would mess something up. In the last scene, the little girl's parents are beside her, thankful that she is safe. When Shaun walks in, they express their gratitude for saving their daughter. That was all from the video. I hope you liked it. Subscribe for more content like this and hit the like button to help us out. Also, leave a comment if you want us to recap your favorite movie. Until next time, take care.